As we're all aware, these are unprecedented times. My phone has been ringing off the hook with text messages, social media, people looking for answers. It's probably going to need to be recharged a couple times before the end of the day. But I'm going to reiterate what I said on Friday, and I'm calling it 4 Cs. I noticed some politicians around are each having their own pet phrases, but mine are the 4 Cs, and of course it's to remain calm, cautious, courteous, and compassionate. And what I mean by that is please remain calm. I know that these are difficult times, but we'll get through this. We have in the past. Please be cautious, meaning social distancing. It's been said 1,000 times, wash your hands, self-isolate, you know who you are if you need to do that. Cautious, courteous, be respectful of your fellow person, don't hoard, and also be compassionate. By compassionate, I mean there are those of us that will get through this without absolutely any symptoms, and there will be those of us that will be struggling. If everybody adopts a neighbor, helps out your elderly neighbor, get groceries for them, whatever they need, their pharmaceuticals, shovel their walk if need be, and be respectful and try to help out. And if everybody helps out one neighbor, we'll all be fine. We've got single parents now who are without childcare, who may still have to go to work. If you can somehow help them out as well, that would be great. And I've said it many, many times before, but I am extremely proud to be the mayor of this city. Although we do have our problems, in the greatest city in the greatest province and the greatest country, Canada, and we will get through this together. My phone has actually been ringing from people I haven't heard of, friends from around the world, old high school friends from Vietnam, from Colorado, from Indiana, just checking in to see how I'm doing, which I really appreciate, and because they're worried about the leaders and the stress on us. But let me just reiterate that once again, your city council has the best intentions at heart, and I can't say enough about my staff and Merrick here. We've been through this many, many times, and as I've said, we will get through this again. And I have the utmost confidence in my staff. As well, personally, I've had the wolves at the door and thought that maybe it may have been the end of days, but I got through it, and you will as well. So please also, if you can, help support some of our local businesses. They are struggling right now, and if you can help them in whatever way that is still responsible, please do that. So I would like to introduce Merrick, and he will reiterate some of the things and answer some questions. Thank you.
Thank you very much. Merrick Brown, Director, Health, Safety, Environment, and Emergency Management. I just want to start off by stating that from my knowledge, my personal knowledge, there are no reported cases in Medicine Hat at this point. And as you're all aware, we had an abundance of facility closures occur yesterday, including our Viner Centre, Strathcona Centre, our recreation centres. This was not in relation to any sort of confirmed case in Medicine Hat. We are doing this out of an abundance of caution. We are doing this to support the public, support our own employees, and support the province in their effort to basically prevent the mass gatherings and prevent the transmission of this coronavirus. As I stated last week, we enacted our municipal emergency management plan so that we could move through a process in which allows us to work through this in a very conscientious way as it relates to decision making and our incident action planning process. And we have robust plans in the city, and we will get through this. And I want to talk about 3 specific objectives associated with what's occurring here and what you may see throughout whether it be social media or the news and what's occurring here. But our first one is we really want to support the public in this one and support our community. And although the facility closures may seem like a drastic kind of impact here to the community, it really is to support the community, is to limit that social distancing. And so as a responsible employer and as a municipality, that is what we're doing to support this process here. The second part that I wanted to talk about is supporting our own employees here as an employer. So we have instituted a number of measures, facility closures obviously being one of them. So not only are we supporting the public on this one, but we're supporting our own employees' health and safety associated with this one. We have increased cleaning throughout our facilities. We do have work-at-home protocols, which we have enacted. We have mandatory self-isolation processes when required. We have robust facility risk management plans as it relates to hygiene. We have personal protective equipment inventories. The list goes on and on as to how we protect our employees on this one. The third item that I wanted to speak on is it's ensuring the continuity of our essential services. And although our essential services such as our electric generation, utility distributions, our water treatment plant, fire services, and police services, they haven't been impacted from a staffing issue with this one, but we wanted to enact our business continuity planning processes, which we have, to ensure that we don't get to that point where we now have our essential service staff that have been impacted. So all of these aspects relate down to how the community really shouldn't see an impact, and we don't want them to see an impact from this coronavirus as it relates to our essential services. So the last point that I want to make is a reiteration as a municipality and as a responsible employer that I want to encourage all businesses to look at their emergency response plans, look at business continuity plans, encourage different things like remote working or working at home, staying home if you're sick, different things like this. And also, just as for the general public, is we need to be really cognizant that we all have a part in this, and practicing social distancing, ensuring proper hygiene, self-isolating, and staying at home when you're sick. This is critical, as we all have a part to play in this. And so I thank you very much for all of this and the ability to provide this message to you. Do we have any questions?
At this time, with the closures announced, City Hall remains open, at least for now.
For now, I think we need to understand, and we all understand, that this is a very dynamic event, and we see things changing almost on a daily basis. We need to do the same as an employer. So as things change and as the risk level change, if we do have confirmed cases in Medicine Hat, we will evaluate this quite quickly. And as you saw, when the schools closed, in a matter of minutes, or 10 minutes, 15 minutes, we were already starting to close some of our facilities, recognizing that risk level has just risen. And so this is another benefit of our municipal emergency management plan, as it allows us to make these decisions very quickly.
As of right now, you're just recommending that businesses enact their management plan. Are you talking about, are you also asking them to reevaluate how many customers come through the door, that sort of thing?
So we're not asking them to evaluate how many customers come through the door, only to review their own business continuity plans or response plans so that they can stay up and running as an employer, and to limit the obviously the transmission rate as it relates to that, as we want to support our businesses just as we want to support our own employees. As it relates to City Hall and the rate at which people come in is it is business as usual here, but there are obviously alternate methods in which you can actually do business with the city. And so, as I said before, is once we start, if the risk level does change, is we will still provide that opportunity for, I guess, that connection with the city and through City Hall, that is.
We saw that with Calgary's declaration of state of emergency, they've taken the step of enforcing public gatherings through the fire code. Is that available here? And what would trigger that sort of response here?
Yeah, that's a good question. And so a little bit of a different situation as it relates to the city of Calgary and the city of Medicine Hat. And as I mentioned before, is we don't have any confirmed cases in Medicine Hat. Calgary is a little bit different. The city as itself, as a geographical area, is quite different. And they've had a bit of substantial increase over the past couple of days here, and so that they had to move to a little bit more drastic measure than we would at this point. Is so if we again, I go back to the risk level within our kind of geographical boundaries here, is they had to do that in order to contain this, such as limiting the actual persons able to be in one facility at one time, we'll say is, and again, we have the ability to do that, but we need to be very conscientious when we do that, and we have to have a well thought out and justified process as to when we enact a state of local emergency, and we are not there yet.
Do you happen to know either numbers or percentage of city employees who have been told to stay home, work from home? I guess, or are there certain departments that are being told more so to work from home these days?
Yeah, so we focus very much on kind of the essential and necessary services as it relates to our business continuity plan, but we just want to ensure that all of our essential services stay in place. And so I don't have a specific number for you. However, we are encouraging this process just as that responsible employer.
Within the announcement of the Minor Center public closure, there was some discussion there about seniors outreach services and Meals on Wheels continuing to operate. Can you give a description to people who rely on those services or what will be happening?
Yeah, so as it relates to the facilities itself and some of the services that come out of that facility, is the facility in itself is closed to the public, as are all of our other facilities. However, it still is remaining operational inside of that facility. So Meals on Wheels and various other aspects like that are still continuing, obviously with additional precautionary measures put in to protect our own employees' health and safety.
We've done stories over the years about a large number of volunteers with Meals on Wheels being seniors themselves. Do we have any idea if will there be any announcements, or is that being affected by this, I suppose?
At this point, Meals on Wheels has not been affected.
Can I ask you if there's been an increase of people calling 911? That was asked on Friday, and you said that there hadn't been a bump, but have those numbers changed at all?
We haven't seen an increase in 911 calls from my knowledge. However, we have seen an increase in calls into our customer service group here at City Hall, just asking if City Hall is still open, if they can still come in and do their daily business, and the answer to that is absolutely yes. City Hall is still open, and you can still continue to do your business with us.
As far as public meetings go, the number, on the city calendar over the next several days to couple of weeks, are you encouraging citizens to perhaps do a virtual, online streaming of a city council meeting, for example? Yeah.
All of these items actually are being considered, including limiting the number of people allowed in council chambers, spreading council members out to promote the social distancing, practices when you enter council chambers. So all of these are actually being considered. One thing that we do also want to really encourage, though, if you don't necessarily need to come to council or committee meetings, is please don't come, because you can actually get either the minutes of those agendas, or obviously get the live stream or the stream afterwards from that.
Have there been any operational changes at Medicine Hat Regional Airport?
From my knowledge, there has been no operational changes at the airport.
Airports are a big topic in general public. How is that done? I mean, is that provincially or federally regulated, I suppose? But are there any boots on the ground that you know of people talking to travelers when they get off the plane and arrive back in town?
Not from my knowledge as to what's occurring there. As a municipality and the operator of that airport is, we have the responsibility to have the airport operational, because it is deemed an essential services as it relates to medevac flights coming in and out, and so we have that obligation to keep that maintained.
From last week compared to this week for residents in the community, aside from a lot of the closures of city-owned buildings, what are the biggest changes to daily lifestyle that they might see just due to some of the measures that are being taken by the city right now?
So right now, the impacts to the residents is the public facilities at this point, and that's really the only impact that they should see. As it relates to things that occur in the background, such as our essential services, we have enacted our business continuity plan actions, and so you should not see any changes associated with that. Again, I want to reiterate that this is a very dynamic event, and it is evolving. And I think every employer, I don't even want to just say municipality, but as an employer, we're having to change things on the fly here, even as it relates to, policies, as it relates to, people that are at home with school closures. And so we're just like any other employer when it comes down to that piece. And so just, that's why we have emergency response plans in place and robust emergency management plans, is so that we can make these quick decisions. And so it will be evolving and dynamic, and so changes could occur. I can't confirm what those changes are at this time. I mean, I don't know what tomorrow looks like.
Do you have, can you describe the level of coordination, or is there any coordination between Alberta Health and yourself? Are you getting, or the department, are you getting operational updates, or what sort of contact is there?
Yeah, so when we, as part of our municipal management plan, we actually have positions within our facilities, specifically within our incident command post, in which we have that ability and that formal method to talk with Alberta Health Services, and so they have that same position, and so there is that coordinated communication approach.
So you'd be talking with the Provincial Emergency Response Center?
So there's a number of agencies that we actually talk to. So it's Alberta Emergency Management Agency, Alberta Health Services, so it's both, and just general businesses in itself. So Messina College, for example. So.
What would you tell people who maybe, they woke up this morning and they got to go to work and they got to get the kid and they got to figure out what to do with grandma, and they have to figure out if they have groceries. I mean, it can lead to a lot of gridlock for people in daily life. Do you have any suggestion or statement for them?
Yeah, I think we're all seeing this. I mean, even personally, I'm seeing this. I'm sure you're all seeing this. Is we need to all practice a level of calmness. We're all in this together. We need to get through this together, not just as a municipality, but us as an employer and us all as human beings. I mean, we're all impacted this, and so if we can all remain calm in this situation and move through this as a community, you'll see a difference if we can all practice that behavior.